Good afternoon. I'm Dr. Delica. I'm a board-certified periodontist and implant surgeon, and my practice, Delicate Periodontics and Implant Dentistry, is located right here in Palm Beach, specifically in the Wellington area. And I just wanted to come online today to talk to you about some things that I feel patients sometimes struggle with, and just to inform you so you can be better advocates of your own care. So today we're going to be talking about gum recession, but before we get into that, let me tell you what a periodontist is. So a lot of times when people ask me what I do and I say I'm a periodontist, I can see that quizzical look on their face like, okay, what is that? I don't know what that is. What is that? So a periodontist is a dentist that is specialized. They take an additional, usually 3 years after dental school, to study everything surrounding the tooth, meaning the gum tissue, the bone, how inflammation affects these areas of our mouth as well as the rest of our body. We also study many different surgical techniques in terms of improving the gum tissue and the bone around teeth. And we're also very well trained in implants, which is a way to replace missing teeth. So that's what a periodontist is. So next time you hear the word, you'll say, hey, I know what that is. I know who that is. Well, gingival recession is a process that results in the loss of gum tissue. This can happen gradually, and it's something that tends to affect us as we get older. There are generally two camps of patients who are affected by gingival recession. The first set of patients are those who have gum disease, and because of the inflammatory process, over time they're losing the bone and the gingival support around their teeth. But the other camp are people who are very ambitious patients. And why I say that is we note that patients can actually do harm in how they're brushing their teeth, resulting in gingival recession. Food for thought. So back in the day, it used to be very in vogue to use a hard bristle toothbrush because the thought was if I use a harder brush, I'll be able to clean my teeth really well and I won't have cavities. Okay, well, that's all good and everything, but hard bristle brushes tend to lead to recession. And so it's really recommended that you use a soft toothbrush, such as this one here. And in addition to that, I would say it's important to brush a little bit longer, not harder. If you brush a little bit longer, you'll actually be able to remove most of the plaque that's accumulating on your teeth and keep your hot smile healthy. So in addition to that, patients that tend to have a lot of recession may hold their toothbrush like this in a strong grip because they're trying to really brush hard. But you don't have to do this. You can actually hold your toothbrush with 2 to 3 fingers just like this and be able to get to all of the areas in your mouth that you need to clean without causing damage. So 2 things to take away from this: soft bristle brush, hold your toothbrush with 2 to 3 fingers and brush for 2 minutes, and that will be more than enough to keep your mouth clean. Now, why is gingival recession important to treat? A couple of reasons. Whenever you lose gum tissue, you're also losing the bone that supports the tissue. So over time, a gingival recession is really severe. You can actually end up losing your tooth. That's very true. Another reason is the root part of our tooth, which is underneath the bone, is not as dense, it's not as strong as the crowns, which is the part that you see when you smile. And so that area is more easily affected by cavities on the root structure of your tooth. Recession can also lead to sensitivity because, again, that root structure is more porous, making whenever you drink something cold or have air blow through your mouth, you feel that little twinge. Recession can cause that. And finally, it's not very aesthetic. No one wants to smile and see a whole lot of root structure showing because your roots are naturally darker than the rest of your tooth. Now, as for how to treat recession, there are a couple of ways to do this. Some patients opt to have the recessed area of their tooth filled with a white colored filling. Now, while this is fine to do, you'll note that if this is how long your tooth naturally is and you have this much gum tissue, if the gum tissue goes up and you replace it with white, you're basically going to get a longer tooth. And that's what tends to happen when patients replace recession or treat recession with a filling. Another option of this is replacing that missing pink tissue with new pink tissue, and we do this by a couple of ways. One way is called a gingival graft or a connective tissue graft. In either case, this tissue is borrowed from your mouth in another part. usually from the top of your mouth or the palate, and it's transplanted to cover the area where you have gingival recession. It's highly aesthetic. Again, you're replacing the missing pink part with more pink tissue. And it can solve a lot of the things that we talked about, the sensitivity. It can treat the unaesthetic appearance, and it can help you to preserve your tooth for longer. In some patients, we actually opt to use grafting material. That's donated material from another person that's been highly treated, highly processed, and we transplant that into the area where they have recession. And again, it's giving the same result where we're having the tooth area that had recession being covered, and so you alleviate those problems. So I just wanted to leave you all with those little nuggets about gingival recession. It's something that we treat here, and I'm going to leave a picture of a case that we treated recently in the comment section of this video. And yeah, come on by, and if you do come by, you will get one of these lovely new toothbrushes. It'll be totally in the package. It won't be this one, of course, as well as a chapstick and one of our cards, which has more information about our office. And you'll get a tour and get to meet me too. So thank you for tuning in, and I look forward to seeing you again to bring you more pearls about periodontics. Have a great day.